Hi, I'm Daniela. I am the patient care coordinator for Dr. Petropoulos at Potomac Medical Aesthetics. And today we are going to be answering your top cool sculpting questions. So, Dr. Petropoulos, I made a list of the most common questions that we get when patients come in for a cool sculpting consultation. And I wanted to just kind of go over those with you and get your take on the answers. So,
Great.
let's start with, how does it work? Like, how does cool sculpting get rid of fat?
Yeah, it's a really neat technology. And it is based on the fact that fat cells will die at a temperature different than the rest of the structures that are around it. So I can take a cool sculpting applicator, which is essentially a freezing cup, and cool the tissue. So the skin and the fat and all the tissue goes into this cooling cup via suction. And I can apply a temperature of minus 17 degrees Celsius that is going to kill fat cells, but leave everything else intact and not kill the other surrounding structures like skin and blood vessels and nerves. So when we freeze those fat cells that are very susceptible to death because of cold injury, within a day or two after that injury, after the cool sculpting treatment, the fat cells actually start to send off chemical signals saying that it's going through a death process, the fat cells, and it triggers your immune system to go and scavenge those fat cells and use a naturally occurring metabolic process to take those fat cells and digest them into the liver and process them as normal metabolic waste. So it's really neat how it works.
Very cool. So, does it hurt?
It does not. There are some patients will have, there's quite a range of how people perceive it to be. I think the first spot that we do is the one that might be the most uncomfortable because you just don't know what to expect. But having had the procedure and having had so many patients who have had the procedure, pain is not an issue. It feels like a suction cup is going, like almost like a vacuum is tugging on your skin, and it doesn't hurt, it's just suction. And then slowly over the first 5 to 7 minutes, you get this gradual cool sensation on the skin that feels like somebody's slowly putting an ice cube on it. And then it starts to get kind of tingly. Sometimes you feel a little bit of a sharp, tingly, annoying sensation, but never painful. And then the area goes numb for the remaining part of the treatment. So I don't think pain is an accurate description. It's more like an annoying cold sensation that goes away after about 5 minutes. Throughout the rest of the treatment, you don't really feel much except a little bit of cool and some suction until the treatment's done.
Now, if you spend the time, money, and energy to go through this, what are the results like? Is this actually something that's permanent?
It's definitely permanent from all the data that the FDA and Coolsculpting have. They have been doing cool sculpting since the late 1990s with FDA approval in 2009. But from the early patients that were getting cool sculpting, in the early days, they kept really good records through ultrasound of the fat layer. And they continue to do so on the research side of Allergan. And they have not shown any demonstrated return of fat cells once they are killed. So it is the only thing that I can do in my practice that is permanent. Fat cell destruction results in permanent effect.
Wow, that's incredible.
Yeah.
So what is the cost of something like this? Is it expensive?
Yeah, I think that it depends on what areas that we treat. So there are so many parts of the body that we can treat with cool sculpting that the cost varies on the volume of fat that we treat. So if we're just doing the chin, it can be as little as $675. If we're doing the abdomen, on average, depending on how big somebody is and how much tissue, it can be anywhere between $2,500 to $4,000 for the abdomen. The more you treat, the more areas you treat, the less expensive each area becomes. So expensive, I guess it depends on how people look at that, but it's definitely much less expensive than any surgical procedures with great results.
So one thing that we didn't address that I think should be made clear, what kind of results should someone be expecting as far as percentage in reduction of fat loss and those kind of things?
Yeah, that's a great question. And I think that we like in our consultation to really go over pictures to demonstrate what that looks like, because on average, most patients will get about a 20, maybe 25% of a permanent fat cell layer reduction. So to some patients, that can look extraordinary. And to other patients who are expecting massive results, it may not be as impressive. But we definitely have lots of pictures of our own patients, of patients who have gotten one treatment. So you can do Coolsculpting as many times as you want. Most people, I mean, obviously it becomes a budgetary issue, but if you do it one time, you reduce the fat layer by about 20 to 25%. You can retreat that area if there's still enough fat tissue. You can do it as much as you want, but if you do it one time, on average, most patients get a 20 to 25% reduction. Compared to things like liposuction, it's usually about 1/3 of the result, but there are no incisions and the risks are so much different than a surgical procedure. But for some patients, I still may recommend going the surgical route, depending on what their outcomes and their goals are and how what they want to go through and the type of outcomes they're looking for. There's still great surgical patients that I might say Coolsculpting might not be the right choice for you.
So that really leads us into our next question is, who's a good candidate? Like, who would be the best, an ideal candidate that comes in to see you for Coolsculpting?
Yeah. So there are patients that I don't recommend Coolsculpting on. And I think that those candidates have a few conditions that are very easily identified. So there are some patients that can't get it just based on medical issues. I've yet to find somebody that can't have it because of an underlying history of cryoglobulinemia or cold-induced anaphylaxis. Those are really rare things that I'd never even heard of in medical school. So medical reasons not to have it, I have yet to have a patient who couldn't have it for medical reasons. But the patients who are the ideal candidates for Coolsculpting are those who don't have excessive amounts of fat tissue. And so I don't think there's an absolute number, but most patients who have a little bit of extra fat tissue, and I don't know how many pounds that would be, it varies male versus female, but those who have, a little bit of some pinchable fat, a couple inches, who don't have excessively loose skin, who have realistic expectations where if someone's got 2 or 3 inches of pinchable fat and I can sense that they think they're going to get a 6-pack, that's the biggest indication that they may not be a great candidate, unrealistic expectations. But from pure selection criteria, if there's pinchable fat and there's not an excessive amount of loose skin, that's really a great Coolsculpting candidate. That's what I look for typically.
Now, you briefly mentioned, treating the chin, treating the abdominal area. Those are pretty common areas. What other parts of the body can you treat with Coolsculpting?
Yeah, so anywhere where I can grab some fat tissue, I can treat it. The trickiest one, I think that it's hard to do with Coolsculpting. If someone says I have cankles, like excessive fat around the ankles, it's tough to grip that. And so sometimes we have to look for other techniques. But I'll tell you that 99% of what I do is chin, arms, bra fat area, whether it be in the front here where we can pinch fat or above the bra or below the bra. Love handles, so like right below the bra, lower love handles like the flank area, inner thighs, outer thighs, the knees, the banana rolls, which is the junction between the upper thigh and the buttock. That's a nice area to treat. So lots of areas. They have really good results in those areas. They have very specific applicators for some of these areas. We have all those applicators. I think the best way to get the best result is to know where to put the applicator. That comes with experience and training, and to recognize patients that may have, if there's too much loose skin and not enough fat tissue, or where you are looking at a combination. Sometimes I'm not going to treat those areas because it might cause more of a noticeable loose skin. But those are pretty much 99.9% of the areas I've treated. I've done things where, if someone's got fat on their upper back or fat in the right below the knee or above the knee. Those are not as common, but it definitely works. As long as it's fat tissue, it works.
Awesome. So if Coolsculpting sounds like a treatment that you're interested in learning more about, be sure to click the link below this video. We do customized consultations for all of our clients, and we would be happy to invite you in, take a look at your goals, and help you to do our best to help you achieve them.